Hello, everybody. Hello, everybody. This is Jim Daly, Dr. Jim Daly from Daly Manufacturing. It's our first meeting in August. We meet for training sessions like this the first Wednesday of every month. And so this is the August 2022 meeting. We invite people who may be seeing this later on YouTube to actually contact us to see if you want to join our group, because you're certainly welcome to. We open this up to any number of people who are interested in health. Today, I'm going to be talking primarily about black cumin seed, Nigella sativa. It is a spice actually from the Middle East and North Africa that is used in ethnic foods over there, but it's also been used for probably thousands of years as a medicinal herb. And so that's going to be the main topic of today's session. Before we get started, though, I want to remind everyone that if you don't already know, that we have a new book that we just published, written by Betty Reams Hernandez, the daughter of Dr. Carrie Reams. This is a history of the family and how the Reams Biological Theory of Ionization program actually got started, the history of her family, and it's a journey into his life, really, and hers. And I would really encourage people to get this book and read it. I think you'll enjoy it and find it to be very beneficial. We have it in stock now, and it's ready for you to order. Now, when we talk about black cumin seed oil, this is one of our newest products, actually, but also it's one that I've looked at for a lot of years and never really made the jump into making it because I just hadn't seen enough, but that seems to have been mostly because I really hadn't looked hard enough. There's actually quite a bit of research that has been done on this product. It has numerous health benefits. We mentioned last time, just briefly, that it has anti-diabetic effects, and we're going to be talking about that today. It has benefits for rheumatoid arthritis. We're not going to talk a lot about that today, but that's certainly one of the major things that people have used it for. Atherosclerosis, the thymoquinone that's in it inhibits inflammation, migration of THP1 macrophages. It really has a lot of benefits, and we'll sort of brush on that today, but we're going to cover for the most part the anti-diabetic effects and then a few more. So I do want to put out one word of caution, however. We're going to be talking about the effects that it has on, pretty serious diseases. And I want to make it clear that this isn't a substitute for medications for those serious diseases, because it takes a lot longer to work and its effects are not as powerful as the drugs. And so if you're diabetic, you're going to probably need almost for sure to use some diabetic medications, because this will not cure diabetes. If you think you may be going in that direction, you're not diabetic, maybe borderline pre-diabetic, something like that, this could be a big help to you, perhaps to help prevent future disease. It's certainly worth a try, but certainly nobody should use this as a treatment for serious diseases such as diabetes, high blood pressure, cancers, a lot of different things out there that people use alternative medicines for, but this one for sure will not take the place of medical treatment, but it can be a very big part of your overall health program in preventing serious disease, perhaps. Now, the Nigella sativa is a plant that is native to East Asia and the Middle East. Often it's referred to as black seed, black caraway, black cumin, and a number of other names. So it has a lot of common names that are out there that you'll hear. But if you hear people talking about black seed oil, well, that's what it's talking about, is the Nigella sativa. We're calling it black cumin. It is a grass-recognized food, generally recognized as safe, that is used as a spice. Now, it's not a common one, here in the U.S. You're not going to go down to Walmart, for instance, and pick up a bottle of it in the spice section, at least not at my Walmart, because it's used more in ethnic foods of the Middle East, including North Africa. So it's something you might find in a specialty food store, however. The dried roasted seeds are used to flavor curries, vegetables, and beans, and they can be used with seasoning in other recipes that include legumes, vegetables, salads, and poultry. It's, like I said, especially popular in Palestine, and the seeds have been cultivated for at least 3,000 years, and they were found in King Tut's tomb. So they were apparently a prized spice or medicine or something as long ago as when he was alive. And they were placed in the tomb with him, along with, no doubt, a lot of gold, silver, jewels, things like that. So that was kind of the custom back then, to put valuable things that somebody might want in the afterlife, they believed, in the tomb with them. And for him, it was also the black cumin seeds. Now, black cumin seeds are about 32 to 40% oil. They're a very oil-rich seed. Common food lipids include linoleic acid, oleic acid, and palmitic acid. These are things that you will find in seeds such as the oil seeds that we use here for making oils. Aromatic oils include thymoquinone. That is what we think is the main active compound in the black cumin seeds. However, there's also dihydrothymoquinone, pyrazimine, carbacarol. I'm getting that messed up, I think. Alpha-theogen, thymol, alpha-pinene, beta-pinene, and tranxanthasol. So those are just some of the potentially active compounds. And it may be that even if thymoquinone, as we believe, is the main bioactive compound, these other oils and components may well be synergistic with it and help it work better. So we do know that in the research out there, and you'll see some of that in a minute, we'll go over it, that some studies just use the plain seeds, some use the oil, some use extracts, and all of that seems to work in some of these studies. So, whether or not some of these other compounds really help it work better, we don't know, but they're often there in the studies that are reported. However, there are studies that just isolate thymoquinone itself and sell it that way and use it that way in the study as a treatment. And it seems to work just about as well as the herbal extract. So it may be that thymoquinone is the main active component. Now, here's one of our most important slides of this uh, uh, presentation. It really gives you a list of almost all of the studies on diabetes that I have as of now. And that's quite a few of them. There's 10 studies that are clinical trials in humans that I've come up with. Uh, that's actually quite a few human clinical trials for an herbal product. Not too many of them have that many, and a lot of these are in very good journals. Um, let's run down through them. The first one up there in phytotherapy research found used 1,000 milligrams of oil per day. Now that's equivalent to 2 of our little soft gel capsules. So just to give you a rundown, that seems to be a very nice dose for a lot of things. 1,000 milligrams of that oil, it seems to be pretty effective. In this case, it lowered the blood sugar, it lowered total and LDL cholesterol. It also decreased blood pressure, the BMI, and waist circumference. So people had benefits for blood sugar, but also for cholesterol, lowered blood pressure. They lost weight with it in that study. So that was pretty nice results, but not, it's fairly typical as well. And the next one down, Romani et al. Used 2,000 milligrams of the oil and lowered HbA1c, fasting blood sugar, and oxidative parameters, which is what they were looking at particularly. So it lowered, it definitely made the blood sugar regulation a lot better, but also the oxidative damage was improved. And pretty consistent through the research is that it works as a pretty nice antioxidant in the system and prevents oxidative damage. That's the way it works with arthritis and things like that as well. Kitabi et al. In PLOS One, which is a quite nice journal, found that subjects with given with uncontrolled diabetes, given 2,000 milligrams of seed powder per day, had a lower HbA1c. That was after 12 months, a year. It wasn't greatly lower, but it was some lower, but their control group had gone up. So the subjects had gotten better over that period of time, but not, honestly, in this subject, a huge amount better. So that goes back to one of my early statements is this doesn't really substitute for a drug treatment to lower blood glucose if you're diabetic. It won't do it quite that as effectively, probably. Now, they were using seed powder, and 2,000 milligrams of seed powder may not be as great a dose, as high a dose as you would want either. In fact, for some things, it seems like 2,000 milligrams of the oil is probably preferable. But still, it did get people going in the right direction. It didn't get them over their diabetes by any means, but it did keep them from getting worse and help them get a little bit better. Another study in endocrine gave the subjects 1,350 milligrams of oil per day, which they compared head to head with metformin. It actually did lower fasting blood sugar, but not as much as the metformin did. However, it did result in greater weight loss than metformin. Going on down, another group in the Journal of Diabetes and Metabolic Disorders found that 1,000 milligrams lowered fasting blood sugar and inflammation. In another study in India, down here, found that seeds, uh, they were given at 1, 2, or 3 grams of seeds per day uh, to their subjects. And uh, they found that it lowered fasting blood sugar and HbA1c. Uh, this was interesting in that it was a dose response study. And they found that the 2 grams per day in their study uh, gave maximum benefit. The 3 gram per groups didn't have any more benefits. So, it's not necessarily that you just keep piling more on that it's going to be better. In this study, the 2 grams per day uh, was beneficial, and 3 grams no more beneficial. 1 gram, not quite so much. So that's just a kind of a reference to, more is not necessarily better. It's probably not harmful, but it's not going to give you much added benefit either if you go over, a certain threshold there. In the World Journal of Gastroenterology, it was just kind of interesting. They were looking at patients with hepatitis C, and it wasn't really particularly about diabetes, but some of their patients were diabetic and some not. However, it did reduce the viral load in the patients with hepatitis C. It also lowered fasting blood sugar and postprandial uh, blood sugar in the diabetics. And in the non-diabetics as well, both diabetics and non-diabetics had a lowering effect. So that was kind of interesting. It wasn't specifically a study of diabetes, but they did have that in there, and it did work. Answer it all, transplantation. This they gave to patients with diabetic nephropathy. Now, that's a pretty advanced diabetes state, but it did lower the fasting blood sugar, and interesting, it improved the glomerular filtration rate. In other words, kidney function was improved in those patients. I don't know how much long-term benefit there is, but usually, that's getting to be a pretty advanced state of diabetes. So you can't expect it to be reversed by that. Mustafa et al. In Journal of Diabetes Complication looked at people with pre-diabetes, and he only gave them 900 milligrams per day. So not a real high dose, but decreased fasting blood sugar, cholesterol, and triglycerides. And, the fasting blood sugar was pretty significantly reduced. It was enough to bring a pre-diabetic into a non-pre-diabetic range. So it wasn't a huge decrease, but at that point, you don't really need a huge decrease. So that was pretty nice to see that in the pre-diabetics, and at a rather low dose. So that I really like seeing that study. Finally, Rao et al. In Journal of Medicinal Food, this is a journal that I edit, they gave a little bit different approach. They gave food, they made chapatis with a combination of black cumin and fenugreek powder. It had 4.5 grams of that combination per day, divided between 2 chapatis. Most of it was the black cumin, and it lowered fasting blood sugar, the HbA1c quite nicely, and the atherogenic parameters. So it had cardiovascular benefits as well. All of these studies showed some benefit from the black cumin seed study. I didn't find any studies that showed no benefit at all. So that was kind of interesting. Uh, there, I will say there are sometimes publication bias in that the studies that are show no effect often don't get published. They're not as interesting, I guess. So people are not as quick to publish them. But uh, usually you'll see some studies that show benefits and some that don't. And that's one reason they have what they call meta-analyses to put them all together to get the statistical power higher. And there are some meta-analyses on these too. So they're out there as well. Now, talk a little bit about a new drug actually to treat obesity and diabetes called tirzepatide. It's a fairly new drug. It's a dual target drug that targets glucose-dependent insulinotropic factor, GIP, and glucagon-like peptide, GLP. This drug is approved already for diabetes. However, when treating diabetics, they observed that diabetics, besides improved diabetes, also lost weight. And a recent study in endocrinology and metabolism, there we go, reported a study that lasted for 72 weeks, during which time the subjects lost up to 20% of the body weight compared to 3% in controls. Now, in this study, they had to reduce their calorie consumption by 500 calories per day. So it's not just that they took it and their weight went away, but they did lose more weight than the other group. But it's pretty impressive. Most people lost at least some weight. About 90% of the subjects lost at least 5% of their body weight, and a lot of them lost quite a bit more. So seems like a fairly effective drug. Black cumin seed is not that effective for losing weight. It's also not approved for diabetes, and really probably never will be. It's probably not effective enough to be when somebody's got full-blown diabetes to give it to them for a drug. However, one thing that is interesting is that it does seem to work through stimulating GLP-1 at least. So the fact that it showed weight loss benefits and glucose regulation benefits, just like tirzepatide does, was interesting because it's also working through at least one of the same mechanisms as that drug. There weren't any studies out there on the effects of black cumin seed on the GIP, the glucose-dependent insulinotropic factor. However, it did seem to increase insulin release in those studies and the activity. So it did work by potentiating insulin in the studies that we reported. So, it's certainly something that seems to work along the same mechanisms. Now, would I tell you to go out and get tirzepatide right now from your doctor? I would say sit and wait a little bit longer. It's kind of new for that. And the reason I say that is we've been burned a few times in recent years by some of the drugs. If you remember some years ago, it's been about 25 years ago, 30 years ago, we came out with the COX-2, this selective cyclooxygenase 2 inhibitors, and highly effective for treating inflammation, great for arthritis. And it was the hottest thing out there. I remember one of my teachers, a faculty member at university said that, forget about fish oil now, EPA and all of that. We don't need it anymore. We have this wonderful drug that's going to, take care of inflammation for us. The only problem was it turned out to be actually fairly dangerous. Everyone thought it would be, and it was logical to think that it would be a lot safer because it was selected for just the cyclooxygenase 2, whereas things like ibuprofen knock down cyclooxygenase 1 and 2, but 2 seems to be the worst one. So, and it just selectively did that one, but it did it too well apparently, and it was turned out to be a fairly dangerous drug and not much used anymore. So that didn't pan out, but we thought it was a miracle drug and it was wonderful at the time. The next one that came along, and boy, people that I know, friends, were really enthusiastic about that one, was the dexfenfluramine. You may remember the Fen weight loss drug. It was back in the late 90s, I think. I don't remember the exact time, but right at the end when I was at the University of Tennessee, that was being promoted. I remember the department head there was calling up trying to encourage the people in Tennessee, the government people who were in charge of the drug approvals there for Medicaid and that kind of thing, to approve it as a weight loss drug because it was the drug that was going to solve the weight problem. Actually, Richard Workman up at MIT had the patent on it and developed it as a drug, and eventually sold it to a drug company. And at first it looked like it was working great. People were losing weight, and then suddenly they also started developing serious cardiovascular problems. Some did. Ended up, it was taken off the market. The drug company that bought it lost millions of dollars through lawsuits and payouts. The scientist that developed it at MIT, well, he was home free. He had already sold it, collected the money, and he was in good shape. But it was unfortunate. And sometimes these things look wonderful at first. So I would keep my eye, if it's something that you think you'd benefit, I'd say keep your eye on it for another year or so and just see what pans out. If this time next year it seems to be working good and there's no major problems, I'd say go for it. It looks like it has a lot of great benefits and it would be great for losing weight. Right now, I would give it a little bit more time and just wait and see. But if there's a good drug for losing weight, I'm all for it. Any way you can do that, it's a hard thing to do. It's very difficult. And anything that will help people lose weight safely, I'm all for it, whether it's a supplement or a drug or whatever. But what are some of the other benefits that we haven't talked about? I'll mention a few here. Interesting one was hypothyroidism. That's in, this one, this manuscript right here. I'll show it to you. Well, you can't see it, I don't think, very well. Anyway, it's in the Journal of BMC, Complementary and Alternative Medicine. But it showed that 2 grams of powder a day resulted in improved thyroid parameters and decreased body weight in people with Hashimoto's thyroiditis, which is a very common cause of hypothyroidism, low thyroid. So that was really interesting. And, that may be one of the mechanisms by which some people lose weight with the black cumin seed oil. Another study looked at depression, and This was in Iran in soldiers in the military. If you want to read it, you could probably just scan that little thing right there uh, with your iPhone and look at the study too. But 1,000 milligrams, two of our capsules of the oil was used to treat Iranian soldiers for depression. It was quite impressive for treating stress and depression. It was also shown to significantly increase blood concentrations of brain-derived neurotropic factor, BDNF. BDNF is really an important stimulator of brain cell growth and regeneration. It's something that a lot of people can benefit from, especially as you get older. And in people as they develop dementia with age, Alzheimer's disease, you see this decrease quite a bit. So it's a nice thing to see it can be that can work in humans to increase BDNF. It's easy to do it in rats, but it's not as often you see it in human studies. There's also a lot of research out there on cancer treatment, but I've not really looked at those studies yet, to be honest. That's not my area of expertise, but it's out there for those who want to look at it. It's certainly important area, and I really can't say anything about what cancers might or might not benefit. That's just it's out there. It's easy to go to pubmed.gov, pubmed.gov. You can go in there and just put in the search terms. I would put the Nigella sativa. That's a scientific name, so you get all of them. You start putting common names in, different people use different ones. But put in Nigella sativa and whatever you'd like to know. I put in the search bar cancer or depression or whatever you're interested in, and it'll give you a printout of the list of studies that are doing that. I've looked at that, and it's easy and it's a good way to do it. I use PubMed almost every day. Well, let's summarize what we talked about today. Well, black cumin seed has first of all, a very long history of safe use as a food and traditional medicine. And that's important because we know that people have used it for a long time. It's got a great safety record. A lot of new things come out that don't have that history behind them of safe use. So you don't know until you have more experience how safe it is. But really, this has a long history of safe use. The studies have not shown safety issues with it as of now. So it's something that you can feel pretty comfortable with. It seems to have a very wide variety of effects, and the mechanisms are not fully understood. That's something I really want to dig into more because it has so many effects on so many different things that you kind of think there must be something unifying factor there that is making it work that way. But that's something we just have to study a little bit more yet. There's still a lot we don't know. Now, there again, I want to say, whereas the beneficial effects against diseases such as diabetes, hypertension, depression, obesity, etc., seem impressive, and they are impressive, the effects are not large enough to make it an effective drug treatment. So you really have to keep that in mind. If somebody says that they're going to treat their diabetes with black cumin seed oil, I would tell them, you're really asking for trouble because it's not going to do what you're hoping it's going to do. If they have high blood pressure and say, well, I don't want to use those drugs, I want to use black cumin seed oil. Well, you're really asking for a stroke. Just to make a long story short, and that's not something you want. Black cumin seed oil is good. Losing weight is good. There are things that you can do nutritionally to help that, but they don't work overnight. If you have really high blood pressure, you may have a stroke today. And, the blood pressure medications, they'll bring your blood pressure down in a lot of cases, within minutes. So, they're very protective. Now, once you start using them, that doesn't mean you necessarily have to stay on them for the rest of your life. As people improve their diets, they lose weight, a lot of times the blood pressure will start coming down on its own. Actually, just losing weight can make a big difference in blood pressure for a lot of people. Reducing salt can make a big difference in a lot of people, not everybody. So, these things that you can do that and then wean yourself off of the medications if you're able to do so. But don't take chances with serious diseases like that. I hope this has been helpful for you today. I think the black cumin seed oil is really something that would benefit an awful lot of people. So I hope that you don't take my words of caution to mean that you shouldn't use it. It's a very good supplement to use for a lot of things, but use it safely and wisely, and have a wonderful evening, and I'll talk to you next month. Next month, we may do a product development meeting, which will be a little bit more technical. If we can do that, I'm hoping to put that together for next month. But it'll be one where we really look at the research out there that would help us develop a new product. So have a wonderful rest of your evening, and see you next month. Goodbye for now. If you have questions, you're welcome to stay on and listen to our discussion. Any questions out there? Does anyone have any observations or questions about black cumin seed oil or anything else?
Nope.
Okay. Yes.
Oh, I don't have any. I think you covered it very well.
Okay. Anybody else?
No,
Well,
I think I understand.
What's that?
I said, nope, I think you covered it quite thoroughly.
Okay. Well, if anybody's interested in any of the particular topics, I've got the papers, and you're welcome to read them yourself too, and study up some more. It's there's a lot of research on black cumin, so it's not easy to cover it all by any means. And I didn't. I really zeroed in on the diabetes aspect of it. And I'm not even sure I found all the papers on that, but I found a bunch of them. Okay. Well, you all have a good evening then. We'll go and see you next time.